Well, good morning, everyone. Like Judd said, my name is Graham Bufford, and I'm a licensed professional counselor. I'm also a recovering addict, and I am so grateful to be here again. I was here earlier this year. Some of my fondest memories are in this building. Really became a student of the Word here. If you're familiar with Pastor Mark's discipleship class, maybe I was obsessed, but I took that like 6 times. And I also was baptized in the Holy Spirit here. So it's very good to be back. So what I'd like to do today is just kind of go over motivational interviewing with you. And one of the great things about motivational interviewing is we do not need, some kind of specialization. We don't need a license. We don't need a whole lot of specification. Police officers, nurses, teachers can use things like this. And of course, we got to be careful. We're talking about like an actual counseling session. But this is very kind of low key, so to speak, with talking to people about things. But and I know most people aren't like too much of a fan of icebreakers. But just for a few moments, I'd like to get you guys talking a bit. What is it that helps people change in terms of counseling? Like, what is the biggest factor that helps people change? Don't ask Brandon Lackey because you'd be cheating. He knows the answer to this. Maybe some of you already know the answer to this too. But just is it the tools? Is it the content? Is it that person's walk with God? So just spend a minute or two talking amongst yourselves. Like, what is it that actually the biggest factor that contributes to change if we're working one-on-one with someone or actually doing counseling? So I'll check back with you at about 10:10. Okay. So sometimes people don't want to call out stuff, and I understand that. But help me out here. What would be some ideas that we came up with that would be like the biggest thing that helps people change?
Achievable goals.
Goals, okay.
Engagement.
Engagement, okay.
You gotta want different.
Okay, do you mean the person that we're trying to help, they want to be? Yes, yeah.
Desire.
They gotta be motivated, yeah.
The desire.
Desire, okay.
Connection.
What's that?
Connection.
Connection, yeah. Say more about connection.
Make them feel comfortable around you to talk to you about whatever it is that you're trying to help you change.
Yes. Any other ideas? Yes.
I think you have to be believable as the counselor.
Yeah. You have to bring authenticity.
Passionate, authenticity, believable.
Yeah. Not arrogant or prideful, but confident. Like I'm confident that I can help you. We'll figure something out together. So it turns out like we have done like very in-depth research, and I could go into the details of that we could all be bored to death for the next couple hours. I'm not going to do that to us. But we've looked at the skills, we've looked at the theories. Anybody want to take a guess at how many therapeutic approaches there are out there, like as a total? 73, okay. 273, okay. I think last time I checked, it's like 467.
Wow.
Yeah, if we're getting super technical. And so it turns out that time and time again, all over the world, different cultures, different languages, age range, political, spirituality, whatever it is, it's the therapeutic relationship or the counseling relationship. That is the biggest factor that helps people change. Well, that's great news for us, right? So that doesn't mean that we have to be like, the biggest textbook genius or have to know the Bible word for word or whatever. So if we can just make strong connections with people, right, and have some skill and kind of prioritize empathy, then we got it, right? And so this is an approach that kind of really offers that strong connection, but in specific ways. So there are tools and there are skills, but when you kind of look at it, it's very intuitive. And a lot of things that seem to work well it kind of seems like afterwards, after you get used to it, it's like, oh yeah, how come I wasn't doing this before? So motivational interviewing, okay? Motivational interviewing is in the realm of counseling, so to speak, that is within something called the person-centered framework, okay? Hopefully this is not going to offend anybody, but if you look as an example for Christianity, right? So you have Christianity, and then you have two different major branches. You have the Protestant branches, and then you have the Orthodox or the Catholic branches, and those things go down from there. And from the Protestant, we have the various denominations there. Okay. So in counseling, right, it's very similar in that we have counseling or therapy, meaning someone is participating in therapy. A therapist is one who does therapy. Right, so then we have the branch of person-centered, and then we have the branch of structured things, right? So it's in the person-centered. So that approach basically holds that the person that you're talking to is the expert of their own experience. No one knows that person like they do, right? And so we are able to draw from that, like it says in the Bible, like a person of deep understanding can draw things out, draw insight out from a person like a deep well. And so it kind of centers around that. Now, the main population or group of people, if you will, that the folks that created this approach, Milner and Rolnick, if you want to read their book, I encourage you to do that. But they actually cut the teeth on this, so to speak, with substance use or addiction. Right, so this is perfectly in the well house. This is where it originated. But then they started let's see how it works with other things. And then so they started experimenting, tracking, collecting data, and it's very helpful. And so if you're into this kind of thing, or even if you're like a leader that maybe someone on your team is kind of maybe they've gone rogue and they're kind of like acting like a chucklehead. Right, this can be valuable for those things too. But motivational interviewing says that if someone is in any stage of change, then they can move on to another stage of change, even if they're not ready to fix everything in that exact moment. So it's very collaborative, and it strengthens the own person's motivation and commitment to change. Okay, so. I want to talk about this for a second. This may not come as a shock, but when I was much younger, I was a very awkward person. For a little nugget, if you think you also might be a recovering awkward person, there is a person named Vanessa Van Edwards. There's a whole bunch of free stuff she offers. I don't experience any kickbacks from her, I'm not selling her books or whatever. But she that's her shtick, I'm a recovering awkward person. And so when I decided, it's kind of limited options, but when I decided to get my life back together and take this whole counseling thing seriously, I went through Pastor Mark's class. And learned a whole bunch there. But then when I decided to go to graduate school, I had some insight, but I thought I was better than I was, right? Because how people that have addiction don't struggle with ego at all. Brandon, you may appreciate this, but I remember I get through the initial first couple of years, and now I'm doing the clinical stuff, and so the people that have PhDs in counselor education, they're looking at your tapes, they're looking at you take those sessions and take them apart by line of the dialogue. And so I'm doing my first tape review, and she watches about 2 minutes and stops it, and she's like, yeah. I'm just going to go ahead and give this back to you, so you're not ready to have me evaluate anything. And so I was like, pain. So I thought that I was really good at maybe connecting people, and maybe I had some positive experiences, but I still had a lot more to learn. And then later, I was doing another tape session, and another supervisor was looking at it. And you know, if this is the screen, you know, right here, they just kind of went, "You are so flat. Look at you. What is wrong with you?" And I was, you know, again, pain. You know, at that point, I was just kind of like, "This is super serious. Like, please, God, don't let me mess this up." You know. And so, like, this was one of the things that I found and started looking into, and it helped me lighten up. It helped me be more fluid in things, and it also helped me be more flexible. But one of the things I had to understand about my approach to things is rightness, right? You know, someone could have been doing something wrong, and then I'm going to get in there and right that, right? I want to correct. You know, I want to fix. And that in and of itself isn't bad or wrong, and God's way is certainly specific. But you know, a lot of times when we're trying to build rapport or even try to motivate someone for change, it turns out that people that have trauma or people that are born neurodivergent, meaning ADHD, autism, something like that, which is super common. And addiction have something that's called DPR, default psychological resistance. Default psychological resistance. So that means the first input that comes in, it's like, no. Well, I mean, I just think, I'm good. Well, don't you want to talk about, I really don't see the purpose of coming here, right? I'm not using it anymore. Look, I don't have much to talk about, right? Just, you know, what about what you think or whatever, or, you know, I think it would be a good idea. Like, I don't remember asking you what you thought, right? Just very, very resistant. And so we have to learn to roll with that resistance, all right? So our natural instinct is to correct the person or fix the problems we identify. This comes from, you know, genuine caring. But this righting reflex often triggers this psychological you know, resistance in people, causing them to defend their current behavior and then shut down, right? So with motivational interviewing, or MI, teaches us to resist this reflex and instead guide collaboratively, allowing persons to discover their own motivation, right? Because they're the expert of their experience. They're the expert of themselves. So, like with the writing reflex, it's important to remember that there's a difference between, you know, correcting and you know, rebuking or things like that. And certainly, if we have agencies where people live on our campuses and stuff, like there's behaviors, there's standards, there's you know, guideposts and things like that, and we for sure got to have boundaries. But if we're talking with someone one-on-one, I mean, like, we can enforce consequences. But we also can kind of get to the bottom of what's going on, you know, and sometimes, you know, even sitting in those spaces where you ask someone to just kind of sit and think about the consequences of what they've done, and just sitting in there with them sometimes can be very powerful. But if someone perceives us as an enemy, which is super common in addiction, you know, it's going to be difficult to establish that strong connection and then get the results that we're looking for. So when we push for change, people naturally push back, okay? So who here could describe, I'm not looking for the textbook or whatever, but who here could describe what defensiveness means? Defensiveness.
Resistance.
Okay. Anything specific?
You're talking to a group in, like, in general, and somebody automatically, they're getting you with resistance and everything like that. It's like, but I wasn't even talking about you. And then they start getting super defensive. It's like,
Yeah, yeah.
Kind of like selfishness a little bit.
For sure. You know, with what? Yeah, a wall. Exactly. And so, kind of the antithesis of defensiveness is taking personal responsibility, right? So, with things like you know, substance use or trauma, or even more generic, like the victim mindset, right? You know, if I don't have to take personal responsibility for my behavior, right, then, you know, I can continue to manipulate and people feel sorry for me, and then I can just keep doing what I've been doing without much change. right? And so we can understand that and accept that and just kind of, we can even talk about people with that. Like, hey, so do you know what defensiveness means? And also defensiveness is one of the major components of destructive relationships, right? Because who would want to be close to me if I can't accept personal responsibility for my behavior, right? If my wife was sitting here, she would be like, yeah, no one. But the more that you argue for change, the more person is likely to argue against it, right? Okay, so well-intentioned advice can create resistance when people aren't ready to hear it, right? So if they're not ready, kind of seems kind of a logical step to try and see what we can do to increase readiness, right? People feel pressure when we tell them what to do, and so they become defensive. And there is direct persuasion that creates an expert-person relationship, right, kind of hierarchy, rather than a collaborative partnership focused on the person's goals. There is a power differential, if you will, for the person that is the helping or the professional or the counselor or the provider or the therapist, whatever word you want to use, with that person, the other person in the room, and you may not realize it, you might not want to be on like a power tick or whatever, but there is that hierarchy that we have to be aware of. So MI flips this dynamic by evoking the person's own reasons for change, and so there, it talks about values a lot. And so has anybody ever worked with people for a value sort exercise? Anybody ever heard of a value sort exercise? You have? No, behind you.
I haven't done it, but I've read about it, yes. We do it on certain levels, but.
Okay. How do you do that with people?
So let them give what their examples are.
Okay.
What they said is going to be prioritized and where they can kind of feed it back to them slowly.
Okay. Yeah, that's great. A lot of people don't really understand or have ever thought about what their personal values are, and they create a lot of stress for themselves, not knowing that they are living outside of their own values, and that's something that we can bring to their attention. Okay, so ORs, right? A little lingo with MI is like, let's row those ORs, okay? So open-ended questions, reflective listening, affirmations, and summarizing. Now, the good news is the body of Christ can be very, very, very gifted in encouragement and affirmation, right? If we know what the identity in Christ is, if someone makes a mistake, we're like, okay, well, God's word still says the same thing that it said about you yesterday, and, you could blow it again tomorrow, but it's still going to say the same thing about you, right? That's affirmation about a person's identity or character, or encouragement is about a person's behavior. Maybe they did something that they're being written up for, and so they come to session, and it's like, well, you did come here today, so that's something, and you're also willing to talk about the mistake you made, right? This is growth, this is change. And summarizing, we can talk about a lot of different kinds of things in a session, or even in like a leadership meeting with a teammate. And so sometimes it's difficult to capture something all right, what am I walking away with this? Like what is the essence I'm bringing out of this experience? And so summarizing can help with that. Open questions versus closed questions, okay? Has anybody ever been in an experience with someone who's just kind of asking them a rapid fire, a bunch of closed-ended questions? Where were you? How did you get there? Like, well, did you like it? Did you not like it? It's very easy to become resistant and defensive to that, right? With people having issues with substance use, they're often very suspicious of any questions. So why do you want to know? And so if we have something that helps people open up more and kind of like lower that resistance a bit, take advantage of that. So open questions invite exploration and elaboration rather than yes or no short answers. How do you think that affected you? Or what was it that led you to think that way? And one of my personal favorites, and I actually learned this from Pastor Mark. Where did you learn that? Like something about family, or something about relationships, or something about like goals, or something about vision, or purpose or something, and you know, a lot of times they will verbalize that poor perspective on identity. I'm a piece of crap. I'm just an addict or whatever. Like, okay, where'd you learn that? You know, and that can open up a lot of doors. So, as an example, you know, if someone is on medication, you know, like what kind of concerns do you have about medication, or like if maybe they're having disciplinary issues, like, okay, well, like, tell me what you think is fair in terms of living with 50 other substance use people. You know, like, how would you do it? Just use a bunch of drugs and alcohol? Well, okay, I mean, that's not going to work here. Let's try again, you know? So with affirmations, like, again, we can take a lot of advantage of this as Christians, but recognize the person's strengths, efforts, and values, and we can acknowledge a lot of positive aspects about themselves or qualities. You know, so like you've shown real commitment by coming today despite your concerns. Or maybe someone, they're talking about something traumatic, or maybe they're mad at another staff member, or maybe they're mad at some place that they work about or whatever. I'm like, yeah, you were really brave today talking about something that you were mad about. You even got mad at me and nobody died. Like, all right. Reflective listening. Okay. What would be some examples of, like, is your best guess someone's not listening? Like, what's the other person doing that would lead you?
No eye contact.
Oh, I'm listening. Yeah. What else?
No eye contact.
Mm-hmm. Yeah.
Yeah.
Oh, yeah. That's the word I've heard. Yeah. What else?
Messing around with anything besides paying attention to them.
Yes, and I'm glad you mentioned that. That's one of my personal pet peeves. Like, for example, my sister and its family, so of course. But, you know, we could be like just kind of after having a meal together during the holidays, and, you know, the little thing we're watching on TV is over or whatever, and like, hey, you know, I want to talk to you about, you know, like, hey, could you dial up the focus? I really would appreciate you listening. Oh, I'm listening. I'm like, okay. And, you know, I'm certainly not beyond, you know, criticism or, you know, things like that myself. Go back. But reflective listening is actually being able to verbally express that you have captured something that the other person has said and that you are paying attention. So you demonstrate understanding. So, like, I'm trying to think how to ask this question without giving the answer. Okay, what would it look like if you were validating someone's emotions?
Facial expression.
Okay, that's true. What about in words? Okay. What else?
Your feelings are valid.
Okay.
I hear what you're saying.
Okay. What about, like?
Been where you've been.
Yeah.
Yeah.
Okay. For sure. What about things like? Yeah, you're really pissed off about that.
Yeah.
You know, like, yeah, you feel kind of unsure of what to do next. You know, like, actually best guess what the feeling is itself and then reflect that back to them. And when you really land one of these things, it's really great because people, like, almost always will be like, yes, thank you, you know. And so there's a lot of power in that. Validation is huge and great news. And we can even lead with people telling this, like, all of our emotions are always 100% valid. So good. But that doesn't mean everything we say, think, and do is helpful or rational. Emotions are always valid, right? And that's an even door we can open by helping people understand the difference between what they feel from what they think.
Right.
All right? So with summarizing, I know I'm in a room with very smart people, so I know you know what a summary is. But it helps also to transition between topics or even transition between sessions. And it also can show, again, that you're listening, okay? So this is kind of the strategy behind this, okay? So we want to engage, we want to focus, we want to evoke, and we also want to plan, okay? Who here has heard of a SMART goal? Okay, so anyone, what's a SMART goal?
Specific, measurable,
Attainable.
attainable, realistic, time sensitive, time bound.
Yeah, time-based, exactly, yeah, exactly. And then another word for the A would be, what did you say, achievable?
Attainable.
Okay, so achievable would be another word for that. yeah, and so it's very difficult to not like go forward with a SMART goal, right? Because it's very focused, and so that's part of the planning process. But when we engage someone, we want to try and see what we can do with the conversation of itself as it is and how it starts and how it is developed, right? It's kind of like a meta awareness, right? And you can get good at it if you practice. But like, it's very tempting. Let's say someone has a discipline issue. It's very tempting to just go like, right, why don't you look at how many times you talk about that? But you know how much I care about you, and just you know, because maybe you're mad, right? Which valid, you know, but like maybe kind of take a step back sometimes for what you think is the most pressing issue to talk about, right? And you can still do that, but maybe engage someone like, okay, what do you think is the biggest issue to talk about today, right? Or what do you think's been the biggest thing on your mind since the last time we spoke? You know, so that's engaging, focusing. So I really did not understand how much I did not focus on until I became sober. I was not paying attention to all kinds of things, right? You know, it's kind of like when I started to pay attention, be able to track, you know, started with like being able to find stuff like, oh, I know where my shoes are now. That's great, you know. But as more time went on, I was able to focus more about things in my mind. I was able to be more attentive to my own behavior. But if you've ever been, you know, like session after session after session after session after session, like our minds can kind of start to wander a bit, you know, and that's part of what it means to be human. You know, you can focus on specific things, and visual representations are good if you have like a dry erase board or something to kind of like let that guide the session. But you know, focusing can also just help a person focus themselves. You know, like mindfulness techniques or whatever. Does anybody know how mindfulness works or how that is effective? Mindfulness. Pretty ingenious idea, right? Our brain has limited processing power. What can it actively focus on in the moment? And so when we draw our attention to our physical senses, it's linked to our survival, and so it's difficult to, you know, focus on anything else. That's something that we can help people do. But evoking, okay, so we want to draw out, right? We want to draw out the motivation and change talk, and then also be able to reflect back that person's own reason to change. You know, so maybe, you know, you hear this. This is one of my all-time favorite things to hear when I was a counselor before I was licensed, but I was working in residential recovery. But like, you know, like after about like maybe a good 30 to 60 days, right, you know, we can start remembering things, and people will be like, all right, you know, so I know what my issue is. Okay, great. Well, what is it? I need a job. I need a job, and then I need a job, and a job, and a job. Right, cool. So if a job was enough to help you, we could just line people up at the employment office, right, and just revolving door, like you're cured, right? Well, like so, what would you know, some evoking questions or whatever, like, okay, so what is it that you think a job will do for you, right? I remember one time I was working in a group. And we were talking about like goals to work on, and someone had made the statement that they wanted to quit smoking. And I asked them, you know, okay, well, what's your goal? Like, how are you going to work this out? And they said, well, I'm going to work on my recovery. I'm going to stay focused on my program, and I'm not going to do drugs and alcohol. Cool. What are your goals to work on not smoking? It looked around like, how come this answer isn't working? This is usually what I say if people leave me alone. You know, but I'm going to work on my recovery. I'm going to stay focused on my program. I'm not going to do drugs and alcohol anymore. You know, so like evoking something different besides these repeated responses that people have, right? And, you know, we want to be collaborative. We want them involved in the process instead of telling people what to do. Right, and you know, I know it's different in residential versus meeting someone outside of a recovery place. That's obviously a very different setting, a different environment. But you also can evoke out of people like that maybe they're disengaged. You know, so like maybe someone says, well, I've tried counseling before and it didn't work. You know, and you could think about something that I also picked up with Pastor Mark, but like, okay, maybe you went and you didn't work. You know, but you know, kind of like, okay, what kinds of things did you experience? Like, what kinds of things did you draw out of that? Like, how were you able to apply what you learned from those sessions so far? You know, and those can evoke a lot, right? But the four processes represent the flow of motivational interviewing conversation with the OR skills applied through in different ways depending on where the person is in their change journey. Okay. So this is kind of like an overview, like a bird's eye view of all this with process, the OR focus, and the goal itself. When we're engaging, we're asking open-ended questions, we're reflecting back, and so we're trying to establish that relationship or even maintain the connection. Maybe we had to do something that they disagreed with, such as enforce boundaries with consequences, and now they're mad at us. You know, like, I thought we were buddies, I thought we were best friends. Like, okay, well, let's talk about that. So do you think a friend would not enforce consequences or, you know, have expectations of responsible behavior? You know, no? Okay, well, let's talk about what friends are.
Amen.
Right? Focusing, so like summarizing, like let's see if we can't crystallize some stuff, asking them that and see what they come with first, right? We can do it, of course, but when they get used to it, they will start to do it themselves and transition from topics and stuff like that. And so it helps them focus even on conversations that they have with maybe other staff about behavior or something, you know, even if they're upset, you know, they can start to pick up like, all right, so what I'm walking away with is I need not do that again, and then you'll leave me alone. Yeah, you know, but evoking, again, we want to bring the reflections, but we also want to affirm the human being, right? A lot of times, people have found them in a place to not know what to do anymore because they don't know who they are, right?
Right.
And so we want to draw out the change talk, which we'll talk about, and plan some more open questions, summarizing, but we want to develop concrete action steps, not just vague generalizations, okay? So it's not always linear, and so we can cycle between processes as needed, but we want to stay focused on the OR's mindset. Okay, change talk. So change talk is the language persons use that signals motivation or commitment to change. And so in MI, we listen carefully for these statements and strengthen them through reflections and follow-up questions. People are generally better persuaded by the reasons they themselves discover than those pointed out to them by others. Okay. Anybody want to take a guess as to how that is? All right, let me ask you this. And I, you know, if you are or aren't, I mean, you do what you think is best for the people that you work with. But like, okay, like with something like medications, okay, but you know, we're not talking about whether we're going to use them or not, right? But like when we take medications, do we learn anything different? Typically not, right? So, you know, if someone is able to stop using or whatever, did they learn anything else? They just kind of stopped using, right? That's not a guarantee that they picked up anything, any skills, any insight, be able to kind of like see things and transition, or like be able to like extrapolate some decisions in the past that like had long-lasting consequences, right? So when we do this change, it helps them learn and learn faster, right? Because they got there, right? And it's not like we can't like kind of offer a little, you know, breadcrumbs or even offer something that's more concise in a summary. But when people are able to get to things themselves, it helps them learn, and then the insights stick. Does that make sense? I bet if we were to go through everyone in this room, I bet we could just list all the classes and things that you've been to, all the stuff that you've done for like CEUs or things like that. But I bet the list would get much smaller from things that you actually learned, right? You know, because there's a difference between being able to learn something, apply something, see it in action, just information being thrown at you, right? The irony is I'm doing that right now. Okay. So research shows that the more change talk a person expresses during a session, the more likely they are to actually make behavior changes. And this is why evoking and reinforcing change talk is the central goal. So it can range from kind of tentative expressions of desire to, you know, I'm doing it, like it's happening today. But the stronger the commitment language, the more likely the change will occur. And so we can learn to be able to assess that, right? And, let's say someone is more in the tentative phase, right? So then we want to kind of like help them build into a higher phase instead of maybe like pushing into the hard plan, everything's, on point. And, we have to be wise about that, of course, because there's some things that we don't have a lot of discussion about, like such as behaviors and like if it's residential or, how we participate in things like, yeah, hard stop, like you disobey the rules, you get the consequences. But like a lot of life will continue to live outside of our programs, right? And so there's plenty of examples that we can draw from both inside and outside. So the absence of change talk or the presence of sustained talk that defends the status quo probably need to downshift and start, backing off a little bit and see what we can get specific on and then start to build from there. I don't know if you guys have ever talked with someone where it's important, right? You have a goal on what you want to talk to them about, and it's important, right? And maybe they could disagree, but it's important for them too. But you get this. I don't know. What do you mean? It's just, what? So like, what is it that they lost the script, so to speak? What is it that maybe, flooded them emotionally? Maybe something triggered them, right? So like, let's be attentive to those kinds of things. Okay, darn cats. All right, it's just an acronym. And I remember in college playing a little game with this. But so there's preparatory and then mobilizing change talk, right? So the preparatory is darn. So there's just desire, right? I want, right? I want to, or it would be a good idea if, like okay, yeah, that makes sense. That it would be helpful to do that. Ability, like, the verbiage I can, so. Kind of if someone is like, well, I can't do that. Maybe they got to enforce boundaries with family members. Oh, I can't do that. They'll get mad at me.
Right.
Okay, well let's talk about decisions of when other people feel emotion. Does that always lock us down, right? But once we get to things like, I think I can do that. You're like, cool. All right, let's talk about like how that stays, an object of your focus. A reason. Right? So like we've actually got specific reasons. Has anybody ever worked with someone that might be, maybe the verbiage is like repeat offender, but someone has come back into the program numerous times? Has anybody had those experiences? Okay. What is the reasoning as that's happening? Like, are we just kind of holding the fort down until like we can start thinking thoughts again and then going back and getting high? And then kind of just knowing that this is an option to escape back into, let's hover there until we get some specifics out of that space, And I know, I think that there's a difference between empathy, like I can understand what you're feeling or I can understand what you're going through, and then enablement. Does that make sense?
Yeah.
Okay. Let's make you for that, amen. All right, and then need. Like there's something related to this directness and the word change. Like I need to do that. Okay, so let's talk about this for a little nugget. If someone says like, yeah, I should do that, I should do that. Where do you think they are?
Pre-contemplation.
Well done.
Ability.
Okay, I should do that is ability. So, say more about that.
Well, they think they should do it, which means it's in their ability to do it.
Okay.
Should do it, meaning you think yourself you're able to do that, or you have the capability of doing that.
Okay. Say again.
Need.
Okay. Does anybody know what's up with should statements and how they're not helpful?
Shoulda, coulda, woulda.
Yep.
Like self-sabotage.
Absolutely. It indicates judgment, right? It indicates a lot of judgment, and something that we can actually get some more specific when someone starts using should statements, right? Help them reframe that to either I could or I need to. So that kind of like differentiates, like, okay, where are we with this? Like, okay, you're beating yourself up because something is not happening now and you know that that's important, right? But do you think you could or that you actually need to, right? And should statements also create an irrational expectation towards nothing, right? And whether you are or not all the way up in 12 steps, something that we can gather from that approach is that unrealistic expectations are premeditated resentments. And that is poison, right? So if they're having unrealistic expectations about themselves, right, they can resent themselves, and then that's kind of degrading the process. So just a nugget there. Okay. Mobilizing, all right, commitment. I will, right? So again, if it's like, well, yeah, I should do that. Okay, could, need, will, where are we? I am going to, right? So, or there's time, right? If we're talking about SMART goals, there's a time thing. I will give that a shot by X day, or like by the end of the month or whatever. Like, okay, awesome. Activation, so that's direct readiness, and taking steps, right? There's a series of steps where someone is actively using all the way to where they're in full lifestyle of recovery, and it's many steps. And a lot of those journeys can be very unique to the individual. But the DARN statements indicate growing motivation, but may not predict action. The CAT statements are stronger predictors of actual change, and especially the commitment language. Okay. When you hear CAT statements, the person is moving toward action. This is time to support planning and strengthen commitment. Like when you hear those kinds of verbs, like, okay, like, let's see if we can't get something concrete in terms of what we're actually going to do, right? And when and how. Okay. All right. The darn cats thing, right? I don't know about you, but sometimes the acronyms thing, I don't know, they just give me the ick. It's just kind of like, that's not clever. If you're one of those people, like we're in good company here. But this is why the content within or that it represents matters. So we identify readiness, and we can use that readiness to guide responses into other areas. And then we want to move against the resistance, right? We want to roll with the resistance, but like we want to be strategic about that. Like, what specifically are we resisting, and like, can we lower that to any degree? A lot of things that are new, for example, are very threatening to people that struggle with use or in addiction, right? Because typically how I cope with stress is to numb up and escape my feelings, so I don't have to worry about those. I don't have that anymore. What do I do? Okay. So with readiness, the type of change talk reveals where the person is in their readiness and the motivation for change. Early DARN statements indicate building interest, but not yet commitment. Okay, so we've got a hook. Now we kind of have to see how far we can reel in, right? With guiding responses, recognizing the type of change talk that helps providers tailor their reflections to reinforce and build momentum in the right direction, okay, or the most helpful direction for that person. And with preventing resistance, we want to kind of follow the person's lead by responding to their level of change talk. And this helps avoid arguments. This helps lower resistance that just pushing too hard might create. Right. So depending on how your program works or whatever, you may be talking to someone or seeing someone after they've been working all day. Right. You guys work. Right. So how approachable do you think you are after you've put everything in to the job that day? Right, so let's try and have some empathy for that, or maybe we're working with someone that has high speed, murder to the face insomnia, right? So they're not all there, right? So what can we do to even get clarity where we can talk? How can we open up? Do we need to draw something? Do we have a game that we can play? For counseling or therapy, there's all kinds of stuff like that. Not just pull out an Xbox or a Switch or something. So with the strategic responses to the change talk, okay? So with the desire, maybe someone says I wish I could blank, or I wish I could exercise more. All right, tell me about that. What do you think that would mean for you? What would that represent? If you were to try and get in there once. You went in there and lifted one dumbbell. Tell me what that means for you. right? Or ability. You know, like nothing's preventing me from going out and walking on a daily basis. Like my legs work, you know. Okay. Tell me about that. Like, do you want to walk? Like, do you have experience with walking? Like, are we good with the sun? You know, I remember someone asked me that one time in the recovery because I was very much like out catting around night owl, right? Because I was sleeping through most of the day because I was hungover. And so someone asked me, like, look, man, do you even like the sun? And I was like, huh, no. You know, and then the person was able to, okay, well, let's talk about that. Did you know that like sunlight, vitamin D helps improve your mood? And I was like, really? You know, I'm like, yeah, it's what happens to people when they stay in darkness all the time. There's a message there. Okay. So with commitment, I will start. It's happening. You know, okay, what's the plan? Like what action steps? Like describe them to me in detail. Do I have to? I mean, you don't got to do anything. I mean, but I just need to understand what's going on, you know. Okay. With specific kinds of conversations. Okay, so with an example, just to kind of go over these again, I'd like to be more active with my grandchildren. Okay, so that's desire. I know I could cut down on my drinking if I really tried, right? Okay, ability. So have you ever talked to someone that believes they do not have the ability to stop using? Like it's not possible. This is all that I am. This is all that I deserve. You know. Okay. Well, then we work it from that level, right? Okay. What leads you to think that you can't? Well, I've never been able to do that. Okay. But you walked, and when you couldn't walk before. So I mean, is that kind of where we're going with this? Just because something hasn't happened yet means that it can't? You know. And then maybe we kind of slide a little message in faith in there, right? Reason. Okay, so there's specific reasons I'm doing this. Okay, blood pressure, right? If we're talking about something like that, like okay, you know, if I lost weight, these other things would happen, right? Or if I stopped being so defensive with my mom or my partner or you know my sister or whatever, it probably would help. And I, you know, like this stuff that you keep telling me I'm not responsible for someone else, I can only control what I control. At least that's what I could do. Like, yes. All right. Need. I've got to do something. It's got to happen. Like the stress, it's wigging me out. Like, okay, it's a need, right? So let's talk about how we're going to address that need. Commitment. This time, I'm really going to stick with this medication. Okay. So that's a commitment, right? So let's change that. All right, this time I'm really going to stick with the program. Like I'm going to go all in, okay? And it's day one.
Yeah.
Day one, back in the program, I'm really going to stick it out. Okay, so I know already that you guys have heard that before. All right, how would you respond to that? If it's someone coming back in, how would you respond to that?
So what steps are we gonna take differently?
Okay. Exactly. How is this going to be different from last time? That's great. What else? Coming back in, I'm really going to take it seriously this time.
What did I do wrong last time?
Okay. Yeah. What mistakes happened last time, and then what was the other one? Someone said there.
How can I help you, Mike?
Yeah. What's my role in the different thing, and then someone else?
All it takes is that one time to get it right.
Yeah.
This could be that one time.
It could be it. Yeah. Exactly. So it's still some hope. Yeah. But if someone is coming back in, like I'm really gonna take this seriously. Okay, what does taking something seriously look like for you?
Exactly.
You know, and so it's not that like my answer was better than yours. Okay, like all those were great.
Make
It's
it an
just,
action.
yeah. Okay, like what could be something that we do like today that's just like we're gonna draw a line in the sand. That's just gonna be different. Like what's something symbolic we could do. Right? And maybe we get the word or worship or prayer involved with those things. Absolutely. All right, activation. I'm prepared. Like, you know, what point me in the direction I'm going. Right? So they're prepared to make changes, and then we're taking steps. All right. So like they come back in like, okay, I know you said it's like a good idea to pray every day and stuff, and so like I totally didn't do that, but I did pray this morning. Like, cool. All right, let's talk about how much more can we do about that? What happened when you didn't want to? Okay, well, I mean, I just didn't want to, and that's how far I got. Okay, well, let's talk about that. Like, is that how you see things? Like, I don't want to, And then reality stops. Okay, like, can we talk about that? Okay. So 6 stages, all right? And someone already expressed insight about this earlier, but we have pre-contemplation, right? Not considering change, or maybe we have unawareness of problems. Oh, I don't have a problem. I don't have a problem with drinking. I don't have a problem with heroin. I can stop anytime I want to. Cool. So when's the last time you had a job? So what do you think the word homeless means? You know, well, you know, just people. I mean, if people just left me alone, then I wouldn't have this issue. Yeah. So what do you think control has to do with use? What do you mean? Well, I mean, that's kind of like a classic dilemma with control, right? We want to be able to use and blast ourselves into oblivion all the time and have no consequences for that. Well, is that realistic? Well, I never thought about it that way. Oh, cool. Let's carry that on, right? Contemplation. So this is ambivalence, okay? So, you know, kind of danged if I do, danged if I don't, okay? Like, so what I do here, okay? So little trick with that, right? When you have ambivalence and they're kind of caught between two things, right? Pick the thing that what actually leads towards change and end with that. So as an example, like let's say someone is just kind of ambivalent, like losing weight, not losing weight. And so you could do this thing. This is what we call it in graduate school. Like, okay. So on the one hand, you feel very depressed, very sluggish. You know, it's just kind of not a lot of motivation, and exercise can help with that. And on the other hand, there's a lot of easy steps that exercise could mean. I mean, it's just kind of like moving your body. You don't have to go out there and do the Spartan routine or anything. You know, so you lead with whatever the activation is, right? So preparation. So we're planning and readying for action. So we're actively modifying or changing the behavior, and then maintenance. Okay, so like you know, aftercare, right? So we want to maintain the change, kind of like what the new gentleman was talking about earlier today. Like, okay, so what was working with where you were, and like how motivated are you to keep doing that stuff? Were we just kind of like just phoning it in to get these people to leave me alone? Well, now it's go time, right? You know, you don't have all these layers of scheduling and accountability and stuff or whatever. Now you got to lead yourself. Like, how are we gonna carry that forward? And so maybe this is kind of stating the obvious, but you want to maintain someone in between action and maintenance, ideally. Does that make sense? Yeah. Okay. And then, you know, termination. I remember talking about this word, like where we terminate a group or we terminate counseling or whatever. Someone's like, termination? That just sounds like we're going to kill them. All right, so if you don't like that word, use another word like ending the thing. The slides, we gave you a copy of the slides. They just don't have like the super cool pictures because something Microsoft, and I apologize about that. But so I'm gonna go forward with a little bit more speed. But you know, please look these over, and I want to get to kind of the meat of things with being able to do a demonstration. Okay. So with stages of change, right? Milner and Rolnick, who you know oriented and created and did research on you know what they called motivational interviewing, they did not create the stages of change, but this is how the stages of change aligns with motivational interviewing. So we have stage appropriate interventions, and so you know, fancy word intervention, it just means the thing we're going to use to help the person that's specific. You know, so a value sort like we were talking about earlier is an intervention. If you were to do like an activity like 50 I am statements or something, or to ask them to do, you know, a deep dive into James or something like that, that's an intervention. So these are stage appropriate. And so we are able to move forward, like I was saying earlier, like for the people that have this high resistance. So we're working with the resistance and we're rolling with the resistance, but we're not bulldozing, right? So we are moving forward. And so I want to say a quick word about this, but I wanted to say more, but I unfortunately don't have the time. So normalizing relapse, I want to be clear about this, okay? So we all have our prerogatives, or all have our approaches in our different agencies of what relapse means and what we do with it and all that. But what this is referring to is normalizing a relapse from one stage into a previous stage, or going back into a previous stage. And so like there are different perspectives on whether we want to actually normalize like a relapse of, alcohol or substance use or whatever. I'm not here to defend either one. Just know when you see this, we're trying to have this non-judgmental approach to that, right? Like, okay, we moved backwards. Like, all right, so what happened? Like, where do you think that switch happened? All right, and then what were we doing effective here? And so, okay, let's do we want to try the same thing again, or do we want to switch up the approach? But the people move a lot from these various cycles of change, right? Ideally, we want to help them stay in the action maintenance kind of places. But like I was saying earlier, that's the ideal. But people are very unique creatures. They have all kinds of different experiences and stuff. So everyone staying in action or maintenance just isn't realistic. And so like as best as we want to enforce boundaries with consequences, and if there's mistakes or relapses, and that's what for the drug or alcohol itself, and they knew that going in, okay, then that's what it is. But we want to be as non-judgmental as we can. So both MI and the stages of change recognize that behavior change is rarely linear, so circular, and so we cycle through things. And then the right MI approach will look different depending on the stage. For example, raising awareness is key in pre-contemplation, while strengthening commitment is vital in preparation. Okay, so just some ideas of what could be in each different stage. So with pre-contemplation, we're going to try to establish the relationship. And, if we revert back all the way to pre-contemplation stage, then like maybe it's something that we could do differently, right? We're not above making mistakes. And you could be surprised by how far it could go to actually apologize to a client, a patient, program participant, human being, whatever you call them. There's been several occurrences where I've apologized to someone and they just kind of like did the thing where they just kind of lean back in the chair and take a deep breath. I'm like, I'm just really glad you just apologized. No one apologizes to me, and it's just kind of like, oh, it's so sad. But we maybe want to provide information, okay, and maybe we can empathize with our own personal experience. Okay, so anybody have an idea of how sharing our own personal experience could not be helpful?
War stories.
Yep.
Take over the conversation.
Yeah. Yeah. We've got a story that's going to last 2 sessions.
Yeah.
Yeah,
What were you saying?
It makes it about us, not about them.
yeah. It changes
Exactly.
the focus.
Exactly. And so, there's a fancy term called self-disclosure. So, like, if we're going to do that, we need to ask permission, okay? And if, hey, I have something I want to say about me that I think could be helpful to our conversation, is that cool? And if someone says, no, we don't need to be like, oh, how come? It's a good story. Just move on, But with contemplation, okay, so like ambivalence, okay, so like that or the thing, like what do we want to like highlight is the positive direction that we want to move in, but maybe we can start to elicit the darn change talk, the preparation. So with the preparation stage, like we want to look at steps. Maybe we want to continue to affirm and encourage with boosting confidence, highlighting strengths. Has anybody ever done like strengths finders in like that kind of relationship before? It's a very positive thing. I can't tell you how many people that I've worked with in the past that had no idea they had anything that was strong, right? And so that can really help build motivation. So. What about barriers, right? Like, oh yeah, I'm going to do this, and then I'm going to get my driver's license, and then I'm going to get a job, and then I'm going to use a budget, and everything will be...
Not true.
What if it's not?
Not gonna happen.
And if you've ever been in the place where you've lost a driver's license, right? It's not pleasant. So like, what can we help them anticipate, right? What can we help them understand? Like, okay, patience is a virtue, but like, we gotta like, I will fight, kick, and scratch, metaphorically, for whatever it is that's God's best for my life, you know, like whatever, something happens and I'm going to try to use my tools and my skills, or, you know, encourage myself with the word to try and push through this barrier, right? So let's not feed someone something that's unrealistic, right? Now they're responsible for everything that they do. We don't need to blame ourselves for a mistake someone else makes. But like, let's be realistic about things. So with action, maybe we have different coping strategies when action is happening, but it's not maybe happening at the rate we want it to happen. Deep breathing exercises, mindfulness text, prayer, worship. One of the things I think that's really great about that, if this allows, right, so we have different things in our own programs, but creating their own personal worship list, worship music list or whatever can be a very powerful tool. Maintenance, okay. So we want to talk about relapse, right? We want to talk, either it's in the stage or just drugs and alcohol in general, okay? And if whatever your philosophy is on normalizing the actual alcohol or drug use is your business. But we want to talk about it as something that's factual and that happens and is a risk, right? We want to talk about being able to prevent that. We want to talk about, instead of just like someone pulls out, drugs and just jumping right on that. I remember one time someone had come back into a program I was working with, and they had been in, this was their third time back, and they most engaged I've ever seen them, and we would talk. They weren't my specific person, but they were over at another building, and someone that had lived on the street just like, hey, do you want some X? Immediately said yes, right? And so while we were talking about that, very ashamed of that decision, but one of the things we talked about was like, he didn't even put up a fight. There was no resistance to that. I mean, for what you just told me, like there was no pause, there was no prayer. It was just like, oh, right? So, like, let's talk about those kinds of things. But let's also reinforce intrinsic rewards for change, right? Like, let's talk about the benefit of what it feels like inside to be able to accomplish goals, to understand that, like, we can choose short-term comfort for long-lasting consequences, or we can choose short-term discomfort for long-term gains, right? And be able to talk about that practically. But let's be adaptive in life. Now, I don't mean like flexible that we're going to step outside of our values or do something that's morally comprehensible. But like we can be adaptive at life. We can roll with the change, right? We can even help them understand resistance from other people. Right? Like, so maybe someone is going out on paths or whatever, like, can you believe that mom and dad and everybody was still mad at me for stealing all their stuff and putting it in the pawn shop?
Yeah.
100%. But tell me about that. What led you to think that was something to be different? Well, I was praying and I was seeking God. So do you think maybe God, like with the whole prayer thing, is kind of like this magic bottle and he says, yes, whatever it is that we want when we want it? Let's talk about that. Okay. So some quick things here. Typical cycles. Research shows people cycle through stages 3 to 7 times before achieving lasting change in complex health behaviors. The improvement rate with in kind of working with readiness for change, we can get 75% after just 1 to 2 MI sessions. And with 30%, people who receive MI consistent interventions are about 30% more likely to achieve their behavior change goals. Now, when it comes to very hard, like eyeglass research and stuff, like 30% is good, okay? Like it's rare in, hard quantitative research that the number is going to be like 70 or 80 or something like that. So that's good. Okay. So, kind of an example, James, 45, was referred by his primary care provider for alcohol counseling after abnormal liver functioning tests. He arrives defensive, a doctor's just overreacting and just have a few drinks to unwind after work. So the writing reflexes triggered. Provider initially responds with concern. Your test results suggest drinking is affecting your health. You need to cut back. And James does this. Everyone everyone drinks, it's illegal, it's just not a big deal, right? All right, so shifts to MI. What do you enjoy about drinking? What does it do for you? And then reflection, okay, so it helps you think it helps you relax, okay? And so affirmation, okay, so this helps you take on stress without complaining about it. This is something that you use to cope with, and this is something that you think helps build resilience. You value being a resilient person. So what if we can approach life without all that? I mean, you already are a resilient person, but what if we don't need this anymore? You know, eliciting change talk. As the rapport builds, the provider asks, what less good things have you noticed about your drinking? Like, okay, so what are the trade-offs? Stage progression, James moves from pre-contemplation, no problem, to contemplation. Okay, maybe like my liver failing. Maybe it's affecting me. To preparation, like, all right. I mean, I could try cut it back. Now, this is in a doctor's office, right? This is not in one of our agencies, but the commitment is secured by the end of the session. James says, all right, I'm gonna start this way. I'm gonna do this and see how it works, and then actually like we talked about sleep and how it could be better. Like, let's just see how it helps with sleep. So follow up, James returns reporting better sleep and improved relationship with his wife. He's now considering further reductions after seeing the benefits. Okay, but maybe something more realistic for us is like they can't do it. Okay, so like we kind of established through experimentation that this is not something you could accomplish on your own, right? What now? Okay. All right, so pitfalls, common pitfalls, jumping to advice too soon, right? I think a lot of us are gifted with this insight, right? So someone maybe comes to us and we see it. It's just, there it is. That's the thing, right? And it's just glaringly obvious, right? And so that's a gift, right? That's insight, in how we were made, or it's a gift from the Holy Spirit. That's what it is, right? Like, man, I have a lot of anxiety. Oh, well, I mean, it could be related to gluten, black tar, heroin all the time, But maybe we want to think carefully about that, right? So delay giving advice until you explore the person's perspective and obtain permission to share information. So ignoring ambivalence or resistance. So failing to acknowledge the person's concerns about change can disconnect you from them, right? And so and maybe this isn't true, but to that person it can come off like you just don't care, right? How many times have we heard this? Oh, it's just about money or just your quota for church numbers or something or whatever. But our instance is to argue with that. Now, wait a second. We're a non-profit 501(c), okay? Like, we ain't got nothing, so let's like, okay. All right, so you think you're just a number to me. How would you know that? Right? So we also use those double reflected reflections to validate both sides of ambivalence, but we want to lead with the change thing. So, right, on the one hand, but on the other hand, life, peace, truth, justice, the American way. I'm just kidding. All right. Missing subtle change talk, right? Overlooking quiet hints of motivation can mean missing opportunities. So listen carefully for any darn cat's language, even when embedded in mostly sustained talk, and reflect it selectively. So mismatching intervention to stage, using action-oriented strategies with pre-contemplated persons or basic awareness rating with those ready for action. Okay, so this is something I had to learn telling on myself. So like I had plans, I had things, and I had books, and I had papers, and I had structure, and I had strategy, and I was just so excited to help people. But it kind of like, after a while, I kind of started to realize that I was like that person, like when you want to go visit a gym and you're thinking about joining. It's like, oh yeah, all right, so we're gonna do $25 per week or whatever, and like, well, it used to be 45, but now it's gonna be 20, and like, we'll throw in some gym bags and free drinks for a month. It's kind of like, okay, you're coming on a little strong, just being a little bit more patient and being more sensitive to what that person's bringing into the room. Okay. So rarely assess stage of change and regularly assess the stage of change and adapt your approach accordingly, moving at that person's pace. Okay. So practice reflective listening daily. Okay. So maybe there's that person in your family, it's just kind of like they come into a room and you're like, oh, it's a good day to take a walk, or maybe you've got someone that you're really close to, and you can invite them to help you. Like, hey, so I'm practicing this active, reflective listening thing, or whatever. So can you tell me how it feels when I say something like this? Okay. Be mindful of open questions, right? If you're asking a bunch of closed-ended questions, right, it's going to be likely that someone close us off, but like use open questions for specific purposes. Explore values, what insight maybe the person has about God or the Bible or the body of Christ, those kinds of things. Affirm strength to build confidence. Look for the positive thing. Find the positive thing, right? So let's say someone is 50 years old. They've been in and out of various rehabs like 8 or 9, 10 times. So something positive like, man, you are very tough. What do you mean? Well, I mean, how many times do you think you could have died by now? It's pretty remarkable, you know. So yeah, we don't want them to keep coming back in, right? But there's something positive we can find. Watch and reinforce for the darn cats. Familiarize yourself with those things. You have the handouts. Be patient. And I know, look, life and death is in the power of the tongue, and a lot of people, this could be their last shot, and we know that, okay? But we still can have that mindset, but also just be patient. We cannot make anybody do anything, right? So we can't make anybody think, feel, or do anything different. It's them, all right? And so we can have empathy, but we do not need to be codependent, okay? So, and record and review your successes. And so like with the recording thing, this would be something more for a clinical setting, especially like in graduate school or session. But like make notes of things for sure from session to session, but actually things that you're targeting for change. Okay, so partnering for lasting change. So like we can create like a collaborative environment wherever we are, and people are the undisputed experts on themselves. No one has been with them longer or knows them better than they do themselves. This honors the person's autonomy while providing the structure and support needed to navigate the complex process of change. Okay, so we want to resist the writing reflex. We want to master these oars, listen for darn cats, and we want to make sure that we can apply the stages of change. And we want to empower that person to take ownership of their experience, ownership of what they think, of what they feel, of what they do. We want them to be able to take personal responsibility of whatever it is they decide, for better or for worse, okay? And we want to suspend judgment and assumptions, okay? Very smart people in this room, and you know all kinds of things about all kinds of topics, okay? But like I tell myself often that I do not know everything. I mean, I may know some things, but in that huge space of things that I don't know, there's probably some things that can help me or help that other person, right? I am not all-knowing, and I might see what the biggest issue is or whatever, but that may not be what that person is going to take from me at that moment. Okay. I'll save this Q&A part for later, or maybe we don't get to it. But let's try this demonstration. My volunteer, if you are ready, take a step forward. And so we want to listen. And if you got some paper, you can make some notes. But we want to listen for the darn cats language from our volunteer here. Any oars I might use. If there's any resistance, how could I work with that? And so let's see if we can't find the specific changes our friend is. And so like, am I matching the stage of change? And so how could we, what am I doing to help build commitment to change? Okay? So let's get some chairs.
Oh, we're getting chairs?
We're getting chairs. It's serious now.
Yeah. Chairs.
Our chairs.
Oh, wow. So I'm on this side.
So we're starting off rope right here. Okay, so before we get started, do you think you have something that you could work on?
Yes.
Okay. So it's just kind of meta. And so we'll start with just kind of like me introducing myself and what is it that you're trying to work on? Like just exercise. Okay. So we'll talk about that, and then we'll just take it from there.
Okay.
So just respond as best you can how you would normally to anyone or a counselor you're working with. Okay.
Mm-hmm.
Okay. Well, it's good to be working with you. It looks like I'll be helping you take it from here. So I hear that you're interested in taking a look at exercise.
Yes, absolutely.
Okay. So what specifically about exercise are you maybe taking a look at?
Well, I'm really thinking about, because I'm getting older and I'm not going to live forever. So I really want to do the health benefits, you know, because I did so much bad with my body and my life and my sleeping habits when I was in active addiction. And now it's just part of a holistic approach to get
Okay.
better.
You know, it sounds like that you're aware of mistakes that you've made in the past about that. I think that's a very good thing, especially when we're trying to change into something difficult. It shows that you're a very responsible person. What might you have tried with exercise, if anything, in the past?
Well,
Walking? Was that effective?
it was when I stuck with it.
Okay. So tell me about walking.
We do it every day.
Okay. This is what we do every day.
That's what we do every day.
Okay. Was it something that you did by yourself, or like something that was more targeted? So, you know, like, how was your approach to walking?
It was really a time thing. So if I had 15 minutes, you know, walk a little bit. If I had an hour, I'd still walk a little bit, but I had more time to do it.
Okay.
You know,
Yeah. So I find that when talking about making hard changes like the exercise, you know, if kind of obvious, if more people are into it, people would, you know, be more healthy in general. Work is very stressful. So what don't you like about exercise?
the soreness.
The soreness?
Absolutely.
Okay. Have you tried anything to direct with the soreness itself? Like, you know, have you like tried to resolve the soreness itself?
No.
Okay. So what do you know about how muscles are and how they get sore? Like, what's happening?
I know that they're growing.
Yeah.
Because you tear them, and that's what makes them sore.
Yeah.
I also know that it's painful.
Yeah. Facts.
This is real stuff right here.
Yeah. Facts. Okay. Do you happen to know anything of like what's happening that's specifically causing the pain?
Not at all.
Okay. Well, you know, not to go far too into this, but what happens when that is happening is that it builds up lactic acid in your muscles, and that causes the pain. So you could try something like a supplement called calcium lactate that literally neutralizes the acid. And so it sounds like that if you could be less sore, it might increase the likelihood of you at least giving it a shot.
Yes.
Okay.
Absolutely.
Well, you know, and you know, I don't experience any kickbacks from this, and you know, hopefully it helps, and maybe it doesn't. But you could try like Walgreens or Walmart or something like that. If you're into GNC or things like that, you could give that a shot.
Okay.
It's usually pretty cheap. Okay, so do you like walking?
Not really, but I like the thought of feeling better.
Okay.
You know what I'm saying?
Yeah.
It's like I'm at the point where I want the goal.
Mhm.
I want the fruit off that tree.
Yeah.
But I'm not necessarily wanting to plant that tree.
Yeah.
You know what I mean?
I do.
Alright.
I do know what you mean. What else have you tried in terms of exercise besides walking? Ever?
Ever. We used to do like a little bit of lifting weights, you know?
Okay.
A little bit.
Did you like strength training, free weights, stuff like that?
Man, I sure did.
Okay.
Till I was sore the next day.
Yes. Yes. The soreness seems to be an integral part of this.
That's a real thing.
Yeah. Yeah. Okay. Well, have you considered doing any other exercise besides walking or lifting weights?
No. I didn't know there were.
You know, there are there's all kinds of different things, but did you know that a lot of hard things, like a lot of it is just getting started?
Yeah.
You know, so let me ask you this: what would it mean to you if you